Welcome to Ageless and Outrageous, your favorite podcast about how to age amazingly. I'm urogynecologist and hormone and sexual health expert, Dr. Kristen Jackson. Every week, I share my over 25 years experience to guide both men and women as they age. Listen as I discuss a variety of topics, including hormone optimization, pelvic floor health, maintaining a vibrant sex life, weight gain issues, and skin, hair, and body changes as we age. It's happening to all of us, so listen for some solid scientific knowledge on how to handle these changes. Tune in for a dose of laughter, knowledge, and an honest perspective on the incredible adventure of growing older. Today, I want to really get into the details about muscle. If you've listened before, you know that I talk about muscle as the one huge anti-aging secret. If there's only one thing you want to focus on in this whole mix of information that we get from our doctors and from social media and from the news, how do we stay healthy as we age? Focus on muscle. Anything that you can do to maintain muscle or build muscle as you age is going to have all positive downstream effects. So let's look at muscle today and figure out what it's made of and how we maintain it. Why do we lose muscles as we age? Well, most people will tell you that aging is one of the main factors. Aging slows down cell division everywhere in our body, and our muscles are no different. Plus, we tend to be more sedentary as we age. Therefore, we're not using our muscles and straining and stressing our muscles more, so they shrink or atrophy. Menopause, we know, is a huge factor for muscle loss in women. But women have a big drop in their muscle mass around age 50, which is the time of menopause. We also see this drop around age 40 or younger if that woman has gone through early menopause, which we call premature ovarian insufficiency, or surgical menopause, meaning they've had a surgery where both ovaries were removed. Those younger women also experience that same big drop-off that a woman going through natural menopause would. And it's a bigger drop-off than we would normally anticipate from normal aging. So there has to be something going on with the removal of those hormones at the time of menopause that is negatively affecting muscle. But let's go back to the basics. There are three types of muscle: smooth muscle, cardiac muscle, and skeletal muscle. Smooth muscle is non-striated muscle, and it's involuntary. We don't have control over it. These are the muscles found lining our gut, like our esophagus and our GI system. There are the muscles that line our blood vessels, the muscles in our bladder, in all of our reproductive organs. In fact, the largest smooth muscle in the body is the uterus. And we can see that when a woman is pregnant and she goes into labor, she definitely does not have voluntary control over when those come or how strong they are. That's an involuntary muscle that is contracting to push the baby out. In fact, when we tell women to push when they're trying to deliver a baby, we're not telling them to contract their uterus. We're just telling them to contract their abdominal muscles, which aid the uterus in pushing the baby out. So pretty much anywhere in your body that's going to be a tube, you can almost bet that is going to be lined with smooth muscle. Second type of muscle is cardiac muscle. And obviously, as that sounds, that's the muscle found in our heart. This is striated muscle. It looks different under the microscope. It has these alternating light and dark bands, but this is also involuntary muscle. And cardiac muscle is only found in the heart, nowhere else in the body. And thank goodness our smooth muscle and our cardiac muscle is involuntary. It's a good thing that those muscles are working all the time without us thinking about it. Imagine if you had to voluntarily think about beating your heart one time every second. If we had to do that, we'd never do anything else. We wouldn't be able to sleep. We'd constantly be thinking about how to create the next heartbeat. Or imagine if when you sat down for a meal, you had to think about activating your esophageal muscles and your GI muscles to push the food along the GI system. We wouldn't have time to think about anything else. So when you think about involuntary muscles, don't think about giving up control. Think about, thank goodness I don't have to actively plan every single bodily function that I have. The muscle that we're really talking about today is skeletal muscle. Now, this is striated muscle. It has those light and dark bands when we look at it under the microscope, and this muscle is voluntary. It's under our control. These are the muscles in our arms, legs, back, abs, pretty much anything you would work out at the gym. Each of our striated muscles is made up of hundreds or even thousands of muscle fibers or muscle cells. And inside each muscle cell are the contractile units of the muscle. So these are the units that can pull together to make the muscle shorter when we want to contract the muscle. And those contractile units are called myofibrils, and they're made up of these little parts that repeat over and over again called sarcomeres. The other thing we want to make sure we understand is the proper terminology about muscle. Hyperplasia means an increase in the number of muscle cells. Now, both smooth muscle cells and cardiac muscle cells cannot divide, so they cannot grow by hyperplasia, but striated muscle or our skeletal muscle can grow by hyperplasia. Hypertrophy means an increase in the muscle cell size. So we're not getting any more number of muscle cells, but each muscle cell is getting bigger. And all of the types of muscle cells in our body can undergo hypertrophy or get larger. In fact, hypertrophy is how smooth muscle and cardiac muscle can increase in size. But as I said, we're focusing on skeletal muscle. And we really want to know how skeletal muscle hypertrophies. How does it get bigger and stay healthier? Well, we need to increase the sarcomeres and the myofibrils. Remember, those are the contractile units. We need to have more of those per cell to make the cell bigger. We need to increase the mitochondria in each cell. If you remember 8th grade science, the mitochondria is the powerhouse of the cell. It's developing all the ATP that the cell needs to perform its job. We could also increase the fluid in the cell. If we just fill the cell up with more fluid around the organelles, then we're going to have a bigger muscle cell. So anytime a muscle cell has stress or strain beyond its normal activity, satellite cells around the muscle are stimulated. And when we look at the muscle fibers and we see all of those muscle fibers, the hundreds or thousands I talked about lined up, in between them, we see these other cells that are called satellite cells. And you can think of satellite cells like muscle stem cells. Satellite cells are stimulated when there's an injury to the muscle, and they stimulate muscle growth. And in fact, we can use the number of satellite cells as a marker for muscle growth, meaning people who have more active satellite cells are actively growing muscle, and people who have a lower number or quiet satellite cells are not having muscle growth. So what stimulates muscle growth? How do we get all those benefits that we want? More sarcomeres and myofibrils, more mitochondria, and things like that. We need to look at the receptors on the outside of a muscle cell and see what receptors there are, because it's likely that activation of those receptors are going to make the cell grow. And there are lots of receptors on a muscle cell, but one of them is IGF-1. This is a growth factor receptor, and that makes sense because as we grow, we're having more growth factor come out. Of course, our muscles need to grow with us. But one of the most important receptors on a muscle cell is the androgen receptor. And this is a receptor that can accept testosterone and its derivatives. Androgen receptor stimulation on a muscle cell increases satellite cells, which, as I said, is a marker for muscle cell growth. And DHT, or dihydrotestosterone, has the highest affinity for the androgen receptor. DHT is one of the hormones that testosterone can be converted into by an enzyme called 5-alpha reductase. We can upregulate or increase the number of our androgen receptors on our cells by exercise. And we know that we can also increase the number of androgen receptors with testosterone therapy. So testosterone therapy has been shown to increase muscle fiber hypertrophy, make those cells bigger, increase the number of satellite cells so there's more stimulus to grow muscle, and increase muscle protein synthesis. So using testosterone therapy, stimulating the androgen receptor, has all of these positive effects at the muscle. Now, once you have testosterone or DHT sitting on the androgen receptor, stimulating the muscle to grow, you need the building blocks, right? Now the muscle has to say, okay, time to grow. It's got to pull from our body the building blocks that it needs, and these building blocks are the amino acids that we find in protein. And protein is so important in our diet, and our protein requirement increases as we age. Now, you can listen to my other podcasts about really diving into how much protein do you need in a day. But if you just need a ballpark figure, aim for about 100 grams of protein a day, or about 30 grams of protein with each meal. And if you're not sure how much protein is in food, you can think about 1 cup of Greek yogurt giving you about 25 grams of protein. That's not bad. A cup of Greek yogurt is probably about 150 calories if you use the non-fat version. 4 ounces of chicken or tuna or salmon is going to give you 25 to 30 grams of protein for about 130 to 150 calories. You can use protein bars. There are a huge number of protein bars on the market. I'm not going to recommend any one type of protein bar, but I am going to tell you to read the label and look for a protein bar that has 25 to 30 grams of protein in it, but watch out for a high number of sugar or calories, because unfortunately, some of those protein bars have such a high amount of sugar, it's really not worth the protein shot you're getting because you're getting a large shot of sugar. But there are several versions on the market where you can aim for that 25 to 30 gram protein bar with a low amount of sugar and somewhere between 150 to 200 calories. The other way you can do it is a scoop of protein powder. You're going to get your 25 to 30 grams of protein in a scoop of protein powder. And as long as you're mixing that in something that is not a high calorie drink, these are easy ways to get your 25 to 30 grams of protein at each meal. So we talked about hormones, testosterone specifically, for stimulating muscle growth. We talked about protein for giving the amino acids as the building blocks for muscle growth. The last thing we need is muscle resistance training. You've heard me say it a couple of times, but we need to strain our muscles beyond their normal activity. Just walking around doing our normal day, that's what our muscles are meant to do every day, but that's not going to grow our muscles. We have to work the muscle beyond its normal function. And we do this with some form of resistance. This can be with free weights, resistance bands, the machines you see in the gym, even water resistance, walking through the water and resisting the water. There are also water weights that you can use to make that resistance more. It's really muscle resistance training that will strain our muscle, stimulate the satellite cells, recruit the testosterone in our body to sit on the receptor and make the cell grow. This is where we're going to really see the benefits. And building our muscle is not just for muscle strength and muscle health, although that's a huge benefit. It also keeps our joints healthy. It keeps our tendons and ligaments working well. The benefits of muscle training extend to bone health. When we use our muscles to pull on our bones, that stress on the bones stimulates the bone to grow stronger. There are studies showing exercise, of course, improves cognitive health and cardiovascular health. But just as important as we age is maintaining our muscle so that we keep our balance and we prevent falls. Because falls and all of the problems that come resultant from a fall are one of the number one reasons why we see older patients decline rapidly. So you can have a patient who is generally pretty healthy, but then they have a fall, an accident, a slip and fall, they break their hip, they end up laid up for a long time. Maybe they need surgery. They're in rehab for a period of time. They atrophy more while they are sedentary. They're more at risk for blood clots while they're sedentary. They're more at risk for pneumonia while they're sedentary and they're kind of hurting and they're not taking nice deep breaths. So it's a whole spiraling and circling of things that happen subsequent to that fall. So preventing frailty and preventing imbalance and falls is really, really critical. Again, just like you can look for easy ways to get protein in your diet, you can also look for easy ways to practice your balance. It may sound silly, but the things we do every day, we need to take advantage of them. If you're brushing your teeth twice a day, I always brush my teeth half standing on one foot and half standing on the other foot. Helps me practice my balance. It may look kind of silly, but I'm good with it. I'm the only one saying it, or maybe my husband when he walks in and I'm standing on one foot while I brush my teeth. Also, while you're doing your resistance training with your weights or your bands, think about training and balance together. So if you are a fan of using free weights, you can do bicep curls standing on one foot and then bicep curls standing on the other foot. all of those tiny little stabilizer muscles that we have to use to maintain our balance while we're on one foot, especially as we're moving a weight through a motion, are strengthening while we're doing that. So think about ways to incorporate practicing your balance throughout the day. And it doesn't have to be something that you're doing separate from everything else. You're going to brush your teeth every day. Why not practice your balance while you do that? You're going to have your meals throughout the day. Let's think about ways to maximize the protein in them. So, as I have said, and I will continue to say, focus on muscle for the best anti-aging benefits. And how do we do that? Focusing on protein, focus on resistance training, and proper testosterone replacement. Those things will make a huge difference in our muscles as we age, which then will have a great positive downstream effect on all of our other health markers. Thanks so much for listening to today's episode. No information from this recording is intended as a diagnosis or treatment for any disease. If you are enjoying the show, please subscribe so you don't miss any of our exciting episodes. And we love to hear from our listeners and would be grateful for your positive review. We'll talk next time.